Welcome, everybody, and thank you for taking the time to be with us today. My name is Bill Passion, and I'm with the Strategic Accounts Group here at PatientBond, and I'll kick us off today and then come back during the Q&A. We obviously missed you all in Vegas. I see a number of customers online, so please know we miss seeing you as well. If I am not mistaken, this is probably the 5th webinar we've done in conjunction with the UCA. And without a doubt, we're more excited today for this than any other. We certainly don't need to explain the climate, but we all know that business as usual is long gone. So today the focus is really going to be on revenue. And we pose a question here, and I think the answer really is a resounding yes. And that is, does the patient journey fracture after a telehealth visit? It does. Does the patient journey fracture after a walk-in visit? It does. So again, today is about what we're going to do, moving forward. And there's a few simple things I want to point out before we get going. First off, please do not underestimate the absolute power of consumer science and AI as it relates directly to urgent care revenue. Secondly, one-size-fits-all messaging, single-channel messaging does not, equal revenue, period. And I can't emphasize this enough. And then lastly, automated multi-wave communication, based on consumer science and AI, running 24/7 is really, the new strategy that you need to think about. And the key there is multi-wave. The one-size-fits-all shotgun approach is really a strategy of the past. Final comment before we, get into intros here is that, PatientBond, frankly, has struggled at times, getting this powerful message across. So we did a little bit of a pivot with today's webinar and decided to take more of a storytelling approach, and I think it'll resonate. So I urge you all to hang on until the end because, like any good book, I think the story gets better as it goes along. And I can personally attest to this as I was, jumping out of my seat during the 35th, the 40th minute of yesterday's dry run. So on to some quick intros. Joining me on the panel today is our segmentation guru, SVP of Marketing and Analytics at PatientBond, Brent Walker, and then VP of our Urgent Care Vertical and your patient journey guide, Mike Gianfrancesco. Kind of walk you through just a quick high-level agenda here before I turn it over to Brent. And we're going to talk about consumer science and psychographic segmentation, ramping up your patient volume, tap-ins and the digital health app, maximizing revenue post-virtual visit, still have our walk-ins, bricks with clicks. We'll summary, and then we will pivot to the Q&A. So with that, thank you all again for joining, and I will turn it over to my colleague, Brent. Brent, take it away.
Okay, thanks, Bill. First thing I want to do is preface this whole presentation with an explanation of one of the things that helps make PatientBond so powerful and really unlike anything in the marketplace. PatientBond uses, as Bill was mentioning, a consumer science known as psychographic segmentation. And this is an approach used by industry leaders like Walmart, Walgreens, Geico, and even Porsche to influence consumer behavior in purchase decisions. Now, psychographics pertain to people's attitudes, their values, their lifestyles, and their personalities, and then they're really core to their personal motivations and communication preferences. Now, there are 5 distinct psychographic segments or healthcare consumer types. You see them listed here, and the percentages that you're looking at are really the percentage of that segment across the general population of the United States over the age of 18. So we start with self-achievers on the far left, and this is really the most proactive and wellness-oriented group. They're all about goals, achievement, progress. If they understand that, and they're engaging the system quite a bit, the healthcare system quite a bit, and if they understand that the actions they're taking is helping them to achieve a certain measurable goal, they're going to be both intellectually and emotionally incentivized to carry through on what you're trying to activate them on. Balance seekers, they're also very proactive and wellness oriented, but they're highly independent and highly self-reliant. They're not really accessing the healthcare system until they really need to, but they are very dedicated to their health. This is a group that takes what a doctor says at face value and compares it to a bunch of other variables, and they want options and choices so they can make the decisions for themselves. Priority jugglers, they're going to appear very reactive in maybe a behavioral database. They don't really seek care for themselves. They sacrifice themselves to get cares for their loved ones. They're going to make sure that their loved ones and people they know get all the care they need, and their values are around dedication and being dedicated to their family and friends and making sure they get the care they need. Direction takers, this is what the whole healthcare system thinks we all are. If the doctor says so, execute against it, follow that advice, and make sure that they do what the doctor wants them to do. It's only really 15% of the population, which means that kind of an approach, kind of a hierarchical approach, a paternalistic approach, isn't really working for 85% of the population. And then you've got 31% of the population. The biggest segment is a group called the willful endurers. And this is the group that lives for the here and now. If you cannot frame your proposition in a way that gets them to understand how they immediately benefit and it's simple and hassle-free, you're not going to necessarily be able to activate those behaviors. So as I walked you through those 5 segments, you can tell some are proactive in their healthcare, some are more reactive or disengaged. Some want the clinician to tell them what to do. Others want options and choices to make their own decisions. And then some are more likely to actually visit urgent care centers frequently. And as you can see here, as the chart pops up, one of the segments, willful endurers, account for 2/3 of all frequent urgent care visitors. And the same goes for emergency room and retail clinic visits. And self-achievers, kind of bookended on the healthcare approach continuum, are the second most likely to visit. The interesting thing is, though, they have very different motivations and mindsets. Willful endurers don't really seek medical care very proactively often in general, but they don't like to wait for appointments, and it's all about getting the immediate benefit and not waiting. Self-achievers, on the other hand, think of urgent care as another access point in the healthcare system, which they utilize quite frequently. So they've got different mindsets in how they approach that, and their behaviors look similar, but their motivations are very different. The key for urgent care to drive quick revenue is to identify these people in the marketplace and in your clinics and engage them in ways that appeal to their unique psychographic profile in both messaging and channel mix. So that, Mike, can go on to the next slide here. Okay, so let's talk telehealth and tap-ins specifically. Now, COVID-19 certainly accelerated the adoption of telehealth. But before COVID, these same 2 psychographic segments that like urgent care, willful endurers and self-achievers, accounted for 70% of all telehealth use. So now we're in COVID, okay? COVID changes everything, right? COVID has caused every patient type to rush toward the use of telehealth. You can go on to the next slide here, Mike. I would say not so fast. PatientBond, we've been working with AmeriHealth Caritas of District of Columbia to drive telehealth registrations and utilization during the start and growth of COVID. Now, AmeriHealth, for perspective, is the largest Medicaid insurer in the Washington, D.C. area. And while this is an urgent care presentation, these are the same patients that are coming through your doors. So while we've been working with them to try to boost it, what we're able to do is boost registrations 7.5 times versus what they were able to do before using psychographic messaging. Now, for perspective, yeah, COVID drove up all of telehealth use, but Frost and Sullivan projected only about a 64% growth rate across that industry. We grew at 7.5 times. But what's the most provocative part about this, though, the segments who used telehealth before COVID were the same 2 segments who were responsible for over 80% of AmeriHealth utilization during this time. So it would appear that the psychographic model is very strong and held even during the extreme circumstances of a pandemic. Now, this is just one case study. We're fielding a national market research study this week. In fact, I just got notified that the data are just now coming in today on the topic of digital health attitudes and behaviors specific to urgent care, primary care, and hospitals separately. So we can segment that out and look at those kind of expectations, attitudes, and usage. And we're going to be able to share these data in the coming weeks. So stay tuned on that. So next slide, Mike. Thank you. Here's something I really want to underscore, and Bill said this at the outset. A one-size-fits-all approach with all of your patients is not going to work. And if you're doing this, you're leaving money on the table. Each psychographic segment requires different messages and a channel mix, a unique channel mix. So for instance, self-achievers and balance seekers, they want more emails. They crave information. They're constantly searching, and they're investing themselves into healthcare and trying to figure out what are the best options for themselves. And this format allows for that. Now, on the other hand, other segments like priority jugglers or willful endurers don't have the attention span that the self-achievers and the balance seekers do, and they prefer SMS or text messaging. If you can't hook them in 140 characters, good luck. So what PatientBond does is it personalizes engagement with segment-specific messaging and channel mix to maximize the results across the patient journey. Okay? Now, we can identify a patient segment using a 12-question survey, and it only takes a minute to complete. But that's the most accurate way. It's over 90% predictive. But we know it's not going to be feasible for you to get thousands of patients to complete a survey immediately. So we have that option. We'll talk about that later. But we've also worked with a data scientist of a national data compiler company. It's like the folks who calculate everyone's credit scores. They have records on everybody. So we know statistically projected, the statistically projected segment for everyone over the age of 18 in the United States. So we can get started really quickly. We know how to target and engage your current patients and, importantly, potential new patients in your competitive geography that you want to bring into your clinic. We know who prefers virtual care, who prefers walk-ins, and what services they would like to see your clinic offer, which helps you prioritize the marketing messages. And we also use artificial intelligence in the PatientBond platform to automate all of the engagement based on the patient's psychographic preferences with little to no staff involvement. We'll get into that even more in a second here. But with that background, kind of setting the foundation, I'm going to pass it to Mike, and he's going to take you through these extensive capabilities.
All right, great. Thanks so much, Brent. Thanks so much, Bill. So I'm going to walk you through right now. Let's tackle ramping your patient volume. Obviously, that's top of mind for everybody right now. So what you see on the screen is, hey, congratulations. You folks now have 2 centers. If you have one, you now have 2. You were running your walk-ins before. Now you've also got tap-in. Now you've got to handle the virtual environment as well. So our goals here are clear, and the industry goals are very clear. You got to ramp this volume quickly, and you've got to maximize your revenue. So with that said, let's assume you've already done these, right? They seem pretty obvious, and you definitely should have done them if you haven't. Get out there and let the community know, hey, we've got telemedicine availability awareness. We've got COVID testing, which locations that's at, what are your protocols, what are your hours. You may have also increased your location signage. But let's say that you've done all of that. And as you can see on the screen, hey, I've done all of these, but my revenue is still a fraction of what it was before COVID. Well, what am I going to do now? What do you do now? What you're going to do is you need to reach out to every patient in your database. You need to reach out to them and beyond to new patients as well with a segmentized reason why they should walk in or tap in that is specific to that individual. So your patients and healthcare consumers, they're going to fall into one of these categories below. Reactivation messaging, you got to stay top of mind. Urgent care is a top of mind business. And you do that with growth and awareness communications. Automated visit follow-up. When they come see you, check in with them, see how they're doing post-visit. And you've got to always be prompting for those repeat visits. Condition-specific messaging. If the folks are not feeling better, if that patient doesn't feel better, get them to take action. Get them on an appointment, walk in or tap in and come see you. Care pathways for those of you that do primary care that are on the call. Make sure your patients get every test, they get every screening, and they show up for appointments. New patient acquisition. So we can provide segment and target lists that are most likely to use urgent care, which i.e. are going to be your willful endurers in your area and your self-achievers. So once you have this information, you deploy targeted messaging. And yes, PatientBond does do this. Obviously, we're the ones running the call here, but this is a formula here to get your volume ramped very quickly. Again, urgent care, top of mind business. You segment your patient population. It's got to be automated communications. Your staff is not hitting a button. They're not sending a text. These are running in perpetuity behind the scenes, multi-channel communications, as Brent alluded to at the beginning of the presentation. You have to cater the channel to what resonates the most and is going to get the most eyeballs with each individual segment. And then Bill mentioned it too. Multi-wave communication. It's not just one touch and, hey, we're done with you. Even though, yes, urgent care is acute care, but it's not one touch and we're done with you. We need those repeat visits for our revenue. So let's take a look at an example here. So remember, I'm going to show you a fraction and an example of the workflows that we have for growth and awareness for urgent care. So with this particular patient, this is Sherry. Sherry's a willful endurer. We all have patients, all of you on the call, we all have patients that are willful endurers. These folks are about today. They're about easy, simplistic. You got to tell them, hey, just now, top of mind, now, do it now. These are your number one segments for urgent care. So let's start over on the left here. So we're going to send Sherry an SMS in July, for example. Hey, you got to let her know that COVID testing is available and that she can do it right now. She can either walk in or schedule an appointment by clicking here. Maybe she has some questions about your protocol. She can easily click here to be connected for a virtual visit with you folks. You're serving up that information right to her. In August, remember, Sherry likes a mix of SMS and she likes emails as well. She is a willful endurer. Sherry has kids. So you got to let her know, hey, we got back to school physical for your kids. Don't wait on your pediatrician. And the words that are in purple, folks, those are the words that resonate most with this particular segment, i.e. the willful endurer. Get your kids in now, Sherry, and get back to doing what's important to you today. So you give her some choices right in the email. Hey, I want to schedule an appointment. I need a virtual visit consultation. You're serving up those choices to her to, again, give you a good probability and a good chance that you're going to get those visits booked. And they're right in front of her. If she has questions, of course, she can call you. September. You know what, Sherry? This is seasonal messaging. Do you need a flu shot, Sherry? Just come in today. We got your back for the 2020 flu season, the willful endurer. They do want to know that you do have their back. Once you get them in, they are a very loyal segment. You just got to get them there. So Sherry, come on in today. It's free with most insurances. Again, you can walk in, you can click here, however you'd like to schedule your appointment. In October, and again, folks, sample timeline. This is just a snapshot. Let's wish Sherry a happy birthday. Yes, we do want to wish her a happy birthday, but we also want to serve up some information for Sherry. Hey, Sherry, did you know that we offer telemedicine visits on your terms, Mrs. Willful Endurer, when you want, from where you want? We're here when you need us for quick and easy access. You can do it from an app on your phone. You can click here. It's free. Or as well, go ahead and give us a call if you'd like to. So happy birthday, Sherry. So again, keeping with the channel mix, Sherry gets an SMS in November. It says, hey, Sherry, message from Priority Care. Guess what? It's now time for your annual wellness exam. How do we know that? Because we know that last year, Sherry came in at the end of October, beginning in November, for her wellness exam. So we just want to remind her, hey, you need to come in. You can't do what's important to you if you're not healthy, so you got to get that exam. It's totally easy. Go ahead. Just walk in. You can schedule an appointment by clicking here, or obviously, as I mentioned, you can walk in. December, we all have holiday hours. Some of our time frames change at different centers. We got to let Sherry know, hey, Sherry, again, folks, you're touching base with Sherry. This is, post-visit communications. You're touching base with her. You're letting her know these are our holiday hours. You may think, well, great, it's important we let the community know. But if you look at this messaging, we're also serving up, hey, this is just a reminder that we also offer telemedicine visits. Holiday seasons are busy for everybody. So if Sherry needs you, she can walk in or she can schedule a telemed visit. It's easy, Sherry. Easy. You can do it now. Go ahead and click here to download the app on your phone. And we'll touch on the app a little bit later. So that's one example of a segment and a growth and awareness timeline. So all of these things are running in perpetuity behind the scenes for Sherry and for your centers automatically. Conversely, for those folks that are on the phone that do primary care as well, even those urgent cares, and I'm sure I would bet a lot of you or some of you on the call right now, you may do what's called, primary care light is what I've been hearing a lot of. But let's give you an example of a growth and awareness timeline for primary care. So Steve, up in the upper left, Steve's a balance seeker, completely different segment. Different types of content and messaging and channels are going to resonate differently with Steve than Sherry. So let's start on the left. Steve actually prefers in-app messaging. So he's a balance seeker. They love their options and choices, but they do like reinforced opinions from other sources combined with their providers. The balance seeker is going to seek out information to make the best healthcare decision for them. We want to stay with Steve, and we want to serve up that information. We want to make it as easy as possible to put that power of information into Steve's hands. So let's get him a message. Hey, yeah, we want to let him know that there's COVID testing available. And we also want to say, hey, there's options to go ahead and get your test. You could walk right in. You could schedule an appointment if your primary care do same days. Or if Steve just wants to talk to somebody. For Steve, maybe it's a little bit difficult getting out of the house, so he just wants to talk to somebody via virtual consult. He can do that as well. You're giving him multiple opportunities, and you're giving yourself multiple opportunities to capture that revenue for your center. Remember, folks, this is primary care, August. Hey, Steve, you got to get your blood work done this month. And it's got to be done because you got hypertension, Steve, and you got high cholesterol. So Steve can easily click here for some educational materials where he can read up. He can get that information on why it's important to have that blood analyzed to check for underlying conditions. For cholesterol, again, more information from Steve. He's getting the message from his provider. This is a serious issue, Steve. You got to pay attention to it. But go ahead and check out the AHA's latest article about high cholesterol and how it impacts your heart health. And then, of course, Steve, making it real easy for you. Go ahead and click here to schedule that appointment. Or if you want to view live wait times, again, Steve loves options and choices. In September, hey, Steve, we got your hypertension lab results. They're in. You've got choices to view these results. If you want to talk to a provider, Steve, here's your choices. You can click here for that virtual consult, or you can even click here and we'll take you with a simple link right to your patient portal. If Steve has one, or if you as the providing entity have one as well. Steve has questions, he can call you. Steve's got a lot of choices here. October. Folks, Steve is over the age of 50. So Steve, our records indicate that you are overdue for that colonoscopy. So Steve can click here if he'd like to schedule a pre-visit virtual consultation to get prepared for the colonoscopy. I'm sure he has questions. He is a balance seeker. Or he can click here if he happens to be ready to schedule that appointment. Again, options and choices for his colonoscopy, and serving Steve up with some different methods here to come in and see you. We want to give a happy birthday to Steve as well. And we just want to let him know, again, Steve has options for his healthcare, but he loves you guys because you are in contact with Steve in a very respectful and orderly way, and you're serving Steve up with the information that he so desires. You know what, folks? Steve had mentioned the last time that he was in that he was going on vacation, and he was going overseas, so he needed some travel immunizations. The provider noted that in the chart. And we just want to remind him, hey, to prepare for that trip, you got some immunization choices that you've got to make. Here's some information on the pros and cons of each, maybe some side effects. So we know you're proactive about that health, Steve. He's a balance seeker. So click here to schedule a travel immunization appointment. Again, capturing that revenue, reminding him that he's got to come in. All right, folks. So that was a little bit on the marketing, the growth and awareness end, and really staying with the patient post-visit throughout their journey after you've serviced their healthcare needs. And again, for urgent care, obviously, but for primary care as well. So for tap-ins, okay, this goes to telemed. Now, what I'm going to show you, obviously, is features of a PatientBond, our digital health app. So when we look at this is the next generation patient journey. And I'm not exactly sure who you're using for telehealth. Obviously, I would assume everybody on the phone has some sort of telehealth going right now. But I'm going to show you our solution, and it's an intuitive app with many drivers built in. But I'm going to show you how the process flow works from the time they book the visit, and then eventually later on in the presentation, we're going to talk about how this blends with your walk-in. Because I'm not going to make the assumption here that, hey, everything's going to be telemed now. It needs to be a part of your revenue mix. For sure. But we recognize that the walk-in is still going to be the bread and butter and your main source of revenue. So stay with me here. So we're going to talk about tap-ins right now. This is Sarah. So Sarah doesn't feel well. She needs to see a doctor, but she doesn't want to risk getting COVID. So she says, hey, I'll just use the digital clinic. So right there, she can easily schedule that video visit. And I want to point out too, with us, what we do is we actually brand the app for your center. So it will say priority care, XYZ urgent care. The app will be right on your patient's phone. They will have the loyalty in the palm of their hand. So patients can easily just, hey, start a new video visit. They can come in. They're also going to select their location. Hey, this is where the location I would like to go to. They're going to select, what's the reason for the visit, Sarah? They can do, insurance submission, payment, identification, consent forms. The intake, when it says fully customizable, is because it can mirror exactly what you have today in the center. We don't want to reinvent the wheel. So they can also take the 90-second healthcare consumer segment classifier that Brent had mentioned earlier. Why that's important is because it's used, as you'll see, in clinical follow-up. It's used in the marketing, which you've already seen, reactivation, and it's even used in your RCM. So in this example, I'm going to show you some post-revenue visit drivers, and we're going to take a dive into this here, and you're going to see them throughout the rest of the presentation. But Sarah is now in the waiting room. Your provider sees Sarah, services her healthcare needs. Sarah is very happy. So the automated discharge and reactivation workflows, what happens after Sarah? And this is going to be a big focus of our conversation for today. What happens after that virtual visit? Yes, you can send them discharge instructions electronically, but Sarah can get a satisfaction survey. Tell us how we did today with that social media push. Hey, you gave us a great rating. Do you mind sharing that positive sentiment with the community at large? Clinical care messaging. Send her a message 48 hours later. Are you okay? Do you need somebody to give you a call? Maybe you guys on the phone right now, you follow up with your patients. You put in a phone call with 100% of your patients. Well, guess what? I'm not going to tell you something you don't already know. Nobody picks up the phone today. But if they get this text message, they certainly do respond. And we do this for a variety of our customers, and the data bears that out. Condition-specific messaging with intelligent repeat prompts. We're going to definitely get into that. Intelligent repeat visit prompts. On-demand messaging, lab consults, x-rays, any type of messaging that you want to send out, big for labor optimization. Patient financial responsibility reminders, you can send them a reminder, hey, you do have a bill due. That can come right into the app. Remote patient monitoring is in there as well. Easily prompt for an in-center visit if needed. That escalation queue is key. If the provider saw something they did not like, you can easily set that up. Segmented in-app reactivation messaging. We're going to touch on, you saw some of this on the marketing timelines. But because it's segmented for that maximum resonation, i.e. to get the patient to do what you want them to do, is to go ahead and book another visit. So with the app, and I covered some of these, there's multiple revenue drivers within the app. So the quick consult, I showed you the virtual visit. The quick consult is another opportunity to connect with the patient. So let's say the patient comes in, maybe they want to talk about their labs. This is, at the end of the HIPAA compliant consult, the patient is actually going to be placed in those automated discharge and reactivation workflows as well. So I showed you some of those. And again, I promise you, we're going to take a little bit deeper dive into this because they're very, very, very important, and they cut right to your revenue and increasing it. And of course, don't forget the providers. They're the ones, along with your care coordinators, who are going to be using your digital platform every day. And when this was designed, I promise you, we went the extra mile to make sure that they have the tools that they need, some highlights. They can seamlessly escalate, as I mentioned, to an in-clinic visit if they need. They can bring other staff members into a virtual visit or a quick consult. Those provider notes are going to be very easily captured. Screen share functionality. Patients can share anything stored on their mobile device, tablet, or PC or Mac. The provider can assign tasks to staff members, or your care coordinators can do that. They can initiate automated appointment reminders. So one of the most important ones on here is that the patient from that visit, they could either be automated into those discharge workflows, or they can be dropped by the provider. And the provider can say, hey, I want to put them into this growth and awareness timeline. So we can do either or. Multiple options to get that revenue on back end. So place the patient in the sequence reactivation messaging, as I had mentioned as well. And then, of course, you have to have robust reporting on the back end, analytics. I mean, you got to show the ROI, what's going on, volume, visit reasons, wait time, provider locations, and location queues. Okay. All right. Keeping with the revenue focus, let's go ahead and since we showed you the digital health app, and I've been mentioning, hey, this is what happens post-virtual visit. So now let's take a look at actually some of the post-visit workflows and how these are going to relate to your revenue. So this is what I'm going to show you. I'm going to show you 3 examples of condition-specific follow-up. So we at PatientBond, we've got over 60 of the top urgent care conditions. They're programmed with clinical content, and they are deployed with our customers actually today. So let's go ahead and take a look at it. So the patient is seen, they have an acute respiratory infection. So they would get some messaging, just a subtle discharge reminder. And again, these are multi-channel communications. This could come in via an SMS. This could come in via an email. Take prescribed medication as directed. Cough suppressant is needed. Use a cool mist humidifier and drink clear fluids. Now, what we want to do here, in about 48 hours, we're going to send them a message. Hey, let's check in on them. Clinical status check. Do you have any fevers, chills, body aches, or shortness of breath? Yes or no. Are symptoms worsening, or do you have any new symptoms? Yes or no. If the patient responds yes to either one of these questions, let's prompt them for a visit immediately. Serve it up. It's that intelligent response and repeat visit push. Hey, we at Priority Care, we want to help you achieve your goal of feeling better. Based on your responses, our doctors recommend that follow-up visit. And then, bam, there is your online scheduling link. There is your virtual visit link. You're putting the possibility and the probability for a repeat visit in the palm of the patient's hand. And of course, if they have any questions, they can click to talk as well. And all roads will lead back to your center with this type of messaging. Okay, so hypertension, right? And this, again, I knew that we were going to have some primary care folks on the call as well. So I wanted to mix the two, and obviously there's more urgent care is doing primary care now today. So I didn't want to forget about them. So let's say a patient comes in, they're hypertensive. And that could be a secondary diagnosis or even a third. So we could give them a discharge reminder for that. If they're on medication for hypertension, you really need to take that medication. Avoid that salt. It's horrible for hypertension. Again, about 48 hours, they've just been diagnosed. Maybe they had their medication. Maybe it's 72 hours, right? Let's check in on them. Do you have any headache, numbness, tingling in the extremities? Do you have any shortness of breath? Symptoms getting worse? Do you have any new symptoms? They can easily submit, do it all on their phone. And then if they say yes to any of those, they got to get back in. They got to see you for another visit. Go ahead and schedule us. And I want to point out here too, folks, think about for you, if you're affiliated with a health system, the power of this. If someone comes into your urgent care, you can absolutely utilize this to refer those urgent care patients out to your specialists, out to your primary care docs. That can be their online scheduling link. That can be their virtual visit link. So just keeping them within the health system environment, very, very important with that downstream revenue. Let me give you another example here. Now, wheezing, let's say they come in, take medications as prescribed. And as you folks know on the call, hey, wheezing could be indicative of asthma. Asthma can be a condition that probably should be managed by a primary care provider or allergist, et cetera. So take your medications, take that inhaler, drink plenty of fluids, take those 10 deep breaths, expand those lungs. 48 hours. Hey, do you have any fever, cough, or shortness of breath? Are you feeling better? You're connecting with them. Yes, you can try making a phone call. Good luck getting them to pick up the phone. If they say yes to any of these questions, serve it up. Put it in the palm of their hand. Hey, I want to make an appointment right now, or I have questions. Connecting with the patient. They're not feeling better, and you're giving yourself the best shot at getting that repeat visit and building that revenue. All right. So let's talk a little bit about care pathways. So the condition-specific messaging is more utilized in the urgent care setting. Yes, it can be utilized in primary care as well. But let's talk about care pathways. So these are for chronic conditions, okay? So if you do have primary care, this is managing chronic conditions. So automated care pathways will make sure your patient's going to get the right message at the right time and keep them coming back. So all of you on the call have patients like Randy. I'm going to show you how to keep Randy engaged without your staff having to make 20 or 30 phone calls. So Randy's age 62. He's got diabetes. He's a willful endurer. What does that mean? Again, Randy lives in the here and now. He doesn't care. He does what he likes when he likes. So with Randy, you only want to give Randy short-term goals. If you map out Randy's wellness plan for an entire year, guess what? Randy's going to tune you out and he's not going to do anything. Randy prefers SMS first, followed by an email. So with Randy, in the communications with Randy, as you saw with Sherry, focus on right now and focus on today. Very important. The messaging for him is going to be SMS and email, automated. Your staff is not hitting a button to send these. This is multi-channel messaging that continues in perpetuity. So I'm going to give you an example of what this looks like for Randy. So let's start over on the left. So the words in purple are highlighted because this is the type of content that resonates the most with Randy and has the highest probability of getting Randy to do what you want him to do. So you're going to notice the icons as well in the upper right of each box. That indicates the channel of delivery. I'm not going to read through every single word on these, but let's take a look at the first SMS on the left. Hey, Randy, it's easy to do today. Get a simple blood test to measure your A1C because it's an effective way at managing your type 2 diabetes. Well, guess what? We know Randy doesn't get his A1C. Why? Because Randy lives in the here and now. So we got to stay on Randy to get in there and get his A1C. Day 3, you know what, Randy? We're going to send you an email. Living that life's important to you. Living life the way you want, Randy, is important to you. One of the things you can do today is learn a simple, some simple facts about your A1C and get it checked. And then we tell them, give them a little bit of information, American Diabetes Association, what they recommend. But you'll notice at the bottom of that message, Randy can easily click one of those. Hey, I've had my A1C checked. I don't know my A1C. I got questions. Give me a call. And then we tell Randy, get in, get out, and get back to what's important to you. We're putting this right in front of Randy. We know he didn't check his A1C. So guess what? Day 7, Randy's going to get another message. Randy, act now. He lives in the here and now. To live each day to the fullest, this is your first step. You got to get your A1C checked, Randy. Reply yes or Y to this text. If you had it checked, Randy, we know we didn't have it checked. Reply S to schedule that appointment, or reply Q if you got any questions. We're making it as easy as possible. Randy, Go get your A1C checked. Day 15, email. You did indicate, Randy, on that text reply that you wanted to schedule an appointment, but you sure didn't. So, hey, remember, the A1C, it's a simple blood test, but it's an effective way to diagnose and manage your type 2 diabetes. Again, Randy, did you schedule your appointment? Click here. Do you still need to schedule your appointment? That's day 15. Randy, dragging his feet. Day 26. This is priority care. We're reminding you to see your healthcare provider and manage your A1C. Act now, Randy, and each day will be the best that it can be. Different content in the reply. Hey, reply A if you have an appointment, or reply N if you don't. Making it as easy as possible. Randy, just tell us what's going on. We got to get you in here. So finally, folks, during this care pathway, day 1, day 3, day 7, day 15, day 26, Randy got his A1C checked. So thanks, Randy. More importantly, thank yourself for seeing your doctor. Hopefully you got that chance to discuss and understand your role at A1C level. Click here to tell us about your results. Click here to tell us about your visit. You know what, Randy, get back to doing what's important to you until we have to start our next wave of communications for Randy, which will make sure that he continues on this path to healthier living. So that's an example of a care pathway. Now, how does this differ? How does this differ what type of information we serve up? This is Carrie, age 44, same exact condition, but she's a self-achiever. So with self-achievers, proactive, driven by appearance, treatment and screening, diligent. These folks are task-oriented. They want information. They want information that's going to help them stay healthy long-term. So she wants that long-term plan. She wants it mapped out. This is the segment that you map that out and say, hey, this is where you're going to be, tomorrow. This is where you're going to be 3 months, 6 months, a year, 2 years, etc. So Carrie prefers email first, the self-achiever, then she prefers in-app messaging second. She wants to know those steps needed to manage diabetes. Her care pathway is going to be more educational. We don't have to stay on top of Carrie to get our A1C check because Carrie already does it. She knows she has to do it. She does it. She wants to achieve those healthcare goals. Again, so we're going to utilize email and in-app messaging with Carrie, and it's going to come in an automated fashion. Let's start over on the left, folks. I'm not going to read through every single one of these. I'm just going to show you the differences here. So Carrie's going to get an email to start off. Hey, our health and wellness team, we're going to send you a series of email and in-app messages to remind you of things to do, Carrie, and things not to do to help manage that A1C. Let's give her the information: activity, nutrition, pick up, take those medications. Did she read and understand that email? Does she need to click here to book a consult? That can be virtual. That can be in office. You're serving up the opportunity to capture that revenue. You're doing it in a digital fashion without having to hire additional people. Day 5, message from priority care. Hey, we know, Carrie, staying healthy is important to you to help attain your wellness goals. Go ahead and tell us about your last A1C screening. We know that she got it done. We're very well aware that she did. So, click here if you had a check in the last 3 months, click here to schedule an appointment, etc. Or if she wants to speak to a provider, that's at the bottom as well. Day 7, serve her up another email here. We want you to help you continue down that healthy path. Then you know what? This one talks about diet, a diet for Carrie, who is a diabetic. Hey, click here, these simple and easy recipes. They're a fun way to make changes in your diet. And then we let her know, please choose an option below. Did you find the diet information helpful? Yes or no? Or I would like to speak with my doctor. These are structured responses, folks. They are very easy to respond. They don't have to type anything. They can click there for an appointment. They can respond, et cetera, et cetera. Day 18, Carrie, in-app message. You know what? We got telemedicine available. You got the app on your phone. If you need us, we can help you, with your health goals. We can help you stay on task, which we are doing in this chronic condition pathway, by managing your diabetes from the comfort of your own home. So if she has questions, she can consult with a board-certified doctor, self-achievers. They want to partner with the people that are going to help them achieve those goals. So the average wait time, less than 5 minutes, et cetera, et cetera. Again, so let's, day 30, we're going to give Carrie a medication reminder. Day 44, so we mentioned exercise and how that relates to physical and emotional health. So, and again, serving her up with links at the bottom, again, opportunity to talk to the provider. So that was a lot that I just put at you. Condition-specific messaging, care pathways, that automated digital touch points post-visit, and giving yourself the best opportunity to maximize that revenue. So very important here. So let's talk about walk-ins. And I know we're kind of getting to the end here, so I'm going to move a little briskly. So Lisa wants an office visit. She can either book that right on the app, okay? She can go to your website if you folks have online scheduling, or she can just go ahead and walk right in. So bricks with clicks, enhanced patient journey. This is blending the two, okay? I'm going to show you how we blend the two to maximize the revenue. This is a walk-in visit. Either way, Lisa is now at your center. She's filling out those intake forms. She's ready to be seen by your provider. She has the visit. You service her healthcare needs, and now she's ready for discharge. This is a very important moment in the urgent care journey. Now we need to make sure that we make every attempt to set us up for future revenue by blending the digital patient experience with the walk-in experience. You should be doing this for every walk-in, for every patient, every time. So if you do have an app, and in our case for PatientBond, they can easily download the Branded Center app via the QR code on display at the front desk. And you know what? Let's schedule those repeat visits at the time of discharge, whether or not they are going to be in-center or virtual. If you know they're not going to come back from an in-center, let's get them on a virtual console. If they had lab, and it wasn't a rapid lab, it was a send-out, let's get them on a virtual console the next day. So again, wound care management, multiple things you can be setting appointments for, medication consults. If you do primary care and they need a provider, annual wellness exams, if it's an OCMED, hypertension management, primary care, any immunizations, diabetes management, wellness program if you folks have. So now, Lisa leaves your center. So similar to what I touched on earlier in the presentation, what the heck happens after the visit? I showed you what happens after the virtual visit. Now, this is a walk-in customer. What happens after the visit? So we're unlocking that revenue with digital automation here. Again, multi-channel, multi-wave communications. You're not being a nuisance. All of these communications have a specific purpose. 24 hours. Lisa can get a patient satisfaction survey. That can come across as an SMS, email, or even in the app itself. It can be an NPS, 5-star NPS with drivers. We want to know, A, how we did, and B, we want her to share that positive sentiment with the community at large. So if she had a good experience, we know people go to social media to take a look. Hey, what is this urgent care's ratings like? Of course, you can send her discharge instructions. If she hasn't downloaded the app, you can easily just include that in the communication. Hey, click here to download our app. It's free. At about 48 hours, and I touched on this earlier, care messaging. You know what? Even if you call on 100% of your patients, as I mentioned, again, I'll say it, nobody picks up the phone, okay? So you send them an SMS, an in-app message, or even, hey, are you okay, or do you need a call? Maybe that rash hasn't dissipated. Maybe those meds aren't working. And at this point, you can do your clinical status check. Again, automated, perpetuity, serving it up. Hey, you came in for wheezing. Do you have any cough or shortness of breath? Ask them those quick questions. And then get that repeat visit scheduling prompt based on their responses. If Lisa says, yes, I had a cough, and that's why I came in the first place. Again, multi-channel delivery. On-demand messaging. If you can't get a hold of somebody for a lab to do that consult, they're not answering their phone, and I know how it works today. You could keep making 3 phone calls, next shift changes over, and they're making more phone calls. Send them a text. Send them an email. Hey, your labs are ready. Give us a call. Do you need a medication consult, appointment reminders, critical follow-up? And for you folks on the phone, yes, the patient pay section, your RCM, yes, paying their bill is absolutely a part of the patient journey. It's part of the patient satisfaction here. Let them know, hey, your claim got submitted to insurance, right? It's a simple message. You can send it in an app. You can send it via email. Just let them know. So the expectation is, okay, maybe I paid my copay and maybe I have a bill due, okay. Or for those of you that do card on file that are on the phone right now, hey, you're going to get some chargebacks, why not let them know, hey, we're going to charge, this is priority care, we're going to charge your card on file. Just let them know in a simple message so they know, hey, what is this charge from XYZ LLC? Payment reminders. If they're 30, 60, 90, 120 days late, let them know, how much money do you folks spend on statements, right? And who the heck right now wants to lick an envelope, put a stamp on, write out a check, and put it in the mail? I don't know about you guys, but I pay almost all of my bills online, and my healthcare bills are the only ones that come in the mail that I have to put a check on, put a stamp on, lick the envelope, and put it in the mailbox. Embedded links to your online bill pay, click to call your billing department. This is all about cash flow and statement savings, as well as labor optimization. And then as you guys have seen today, growth, staying with them post-visit. You're not being annoying. You're not being a nuisance. This is a synchronous placement into marketing timeline workflows, as you saw with Sherry and Steve, as well as taking a look at your EMR, your EHR. And this is what we do for our clients today. You mine that data for reactivation. Did Sherry come in for a physical last year? Was it November? Don't you think Sherry should get a reminder in October that says, hey, Sherry, you got to come back in for your annual wellness exam? Obviously testing and location availability. Again, you folks should be doing that today. Seasonal revenue, driver messaging, something like your flu shot, your back to school physicals. You should absolutely, your allergy messaging, any screenings and immunizations, health reminders, referral requests, serving this message up in app based on segment. Is it an SMS? Is it an email? So we're getting to the end here, folks. And I just want to leave you with a couple of things here. So in summary to everything that I've shown you today, and I didn't put any pizzazz on this slide on purpose, reach out to your patients and healthcare consumers. That's what I meant by and beyond. I mean, you want to reach out to the neighborhood with the right message, and you want to do it right now. We got to ramp that volume, okay? So whether it's us, through another vendor, you're doing it yourself, do it right now. Think beyond just telemedicine. As I hope that I've gotten across here today, digital health is much, much more than just a video visit or just a simple Zoom call. A true solution, it has to be able to accommodate those walk-ins and tap-ins. We're not going to make the assumption that, telehealth is going to be all of your visits and you're going to make all of your revenue off of telehealth. Totally not true and totally unrealistic. You've got to be able to do both. And you know what? Because of the recent telehealth adoption, you have to blend the two. You got to do it effectively to maximize that revenue. And again, right to revenue. Maximize that revenue with segmentation in your database. Automation is key. You don't want to hire anybody new to run these. Multi-channel, multi-wave, and condition-specific messaging and communication. And to sum it up, simply put, this works. For us at PatientBond, we're deployed at nearly 1,000 urgent care locations nationwide. So, all right, folks, thank you so much.
So I think with that, folks, I just want to, on behalf of the entire PatientBond family, thank you very much for attending today's webinar. If anyone has any questions or follow-up, please do not hesitate to reach out. We're easy to find. Have a wonderful rest of your day, and happy Friday in a few hours. So thanks again, everybody.